Usually, like when you picture a world-class 22-year-old endurance athlete, you're picturing the absolute pinnacle of biological optimization.
Oh, for sure.
Endless stamina, peak performance, someone who has dialed in every single aspect of their physical health.
Right. I mean, decades of life ahead, completely different physiological priorities than, say, someone in their twilight years.
Exactly. And then, well, if you picture a 72-year-old postmenopausal woman, you naturally assume her biological reality is entirely different. They are on opposite ends of the adult spectrum.
Right. Completely different worlds.
But what if their reproductive and urogenital health were actually identical?
I mean, it sounds like a biological paradox,
It really does.
but the clinical data shows it's a very real phenomenon.
And that paradox, that's the core of our deep dive today. We're investigating this fascinating and honestly somewhat hidden biological overlap. We are looking to answer a very specific question for you today. Does the low estrogen state of functional hypothalamic amenorrhea, which we'll just call FHA for short, and which is often triggered by extreme exercise or undereating, does it actually mirror the profound vaginal dryness and urogenital tissue changes that you see in postmenopausal women?
And to unpack this for you, we're looking at a pretty robust stack of sources today.
Oh yeah, tons of data.
Yeah, we've got clinical practice guidelines from the Endocrine Society and the National Institute for Health and Care Excellence, alongside peer-reviewed medical journals and texts that span both gynecology and sports medicine.
I am incredibly curious about this connection because, we so often think of hormone issues in young athletes just as lost periods.
Right, exactly.
You hear about a gymnast or a runner losing her cycle, and it's almost treated as this convenient side effect of intense training or even a badge of honor.
A sign they're working hard enough.
Exactly. But we completely miss the hidden systemic realities of that estrogen loss. So before we even get into comparing their actual symptoms, I feel like we need to establish how these two vastly different demographics arrive at the exact same hormonal destination.
Right, that's severe hypoestrogenism.
Yeah.
Well, the destination is identical, but the journey to get there couldn't be more different. I mean, if we look at the postmenopausal state first, the mechanism is just a biological inevitability.
Well, it's aging.
Exactly. As a woman ages, her ovaries naturally exhaust their finite supply of follicles. The machinery simply ceases producing estrogen. It's programmed into the life cycle.
It's like the factory is closing its doors for retirement.
Yeah, good way to put it.
But FHA is entirely different because I always picture the ovaries just operating on an automatic loop.
Yeah.
But if they're shutting down in a 22-year-old because of physical stress, there must be an upstream signal getting blocked somewhere.
That's exactly what's happening. FHA is an adaptive, allostatic response to a threat.
Oh.
Yeah, when we talk about allostasis, we're talking about the body actively shifting its baseline just to survive chronic wear and tear.
Oh, wow. Okay.
So when a person experiences severe psychological stress or inadequate caloric intake, which is oftentimes relative energy deficiency in sport, or RADS, or even just excessive exercise, the hypothalamus senses a crisis.
So the hypothalamus is essentially looking at the energy ledger, right?
Exactly.
It sees all this energy going out through, say, marathon training and not enough coming in from food, and it just realizes the math doesn't work for sustaining a pregnancy.
It's a literal energy accounting mechanism, and when it senses that severe deficit, it reduces or completely stops the pulsatile secretion of GnRH.
Gonadotropin-releasing hormone.
Right, and GnRH is the very first domino. When that stops falling, it halts the release of luteinizing hormone and follicle-stimulating hormone from the pituitary gland.
The LH and FSH.
Yeah, and without LH and FSH, the ovaries never get the signal to manufacture estrogen, so the ovarian factory hasn't retired, like in menopause. The brain just stopped sending in the work orders.
Wow. So FHA is essentially the body going into low battery mode.
That's a perfect analogy.
It just shuts down the background apps, in this case, the entire reproductive system, just to keep the core organs running.
Exactly. And what's really fascinating about that low battery mode is how the body actually measures the battery level.
How does it know?
Right. The sources show that women with FHA have significantly lower levels of serum leptin.
Okay, leptin.
Yeah, leptin is a hormone produced by fat cells that tells the brain, hey, we have enough stored energy. But at the same time, they often have very high levels of cortisol circulating in their cerebrospinal fluid.
Just stress hormone.
Right. So high cortisol and low leptin, they act as massive biochemical stop signs to the hypothalamus.
And this isn't rare, is it? I mean, up to a third of secondary amenorrhea cases are FHA.
Yeah, up to a third.
It's incredibly common in environments that heavily emphasize extreme physical output. So, okay, we've established the why. The 72-year-old has no estrogen because of natural aging. The 22-year-old athlete has no estrogen because her hypothalamus is in low battery mode. So, if the estrogen drought is the same, how does this actually manifest physically in the urogenital tract?
Well, let's look at genitourinary syndrome of menopause, or GSM, to understand the baseline of estrogen deprivation.
Okay.
So there's a dense concentration of estrogen receptors on the vagina, the vulva, the urethra, and a specific part of the bladder called the trigone.
Wow, the bladder too.
Oh, absolutely. And estrogen is essentially what keeps those tissues plump, elastic, and well lubricated. It promotes blood flow and maintains collagen density in the actual tissue structure.
So it's a structural pillar. It's not just a reproductive signal.
Exactly. It's structural. So when estrogen drops off after menopause, those tissues literally undergo atrophy.
They just break down.
Yeah, the cellular architecture collapses. They thin out, they lose their elasticity, and they lose moisture. The symptoms are severe, profound vaginal dryness, burning, and dyspareunia.
Which is painful intercourse.
Right. And the friction can actually cause tiny submucosal hemorrhages known as petechia and even microscopic tissue tears.
Ouch. So that is the postmenopausal reality.
Yeah.
But the 22-year-old with FHA, you're saying she is actually experiencing those exact same structural collapses.
She is. The FHA profile intensely mirrors GSM. Because her estrogen is just as depleted, young women with FHA present with a total lack of cervical mucus, pale areolae, and thinned, reddened vaginal and vestibular epithelium.
That is wild.
They suffer from the exact same vaginal dryness, the same tissue fragility, and a significantly lowered libido.
Wow.
Honestly, the physical examination of a 22-year-old with severe FHA can look remarkably similar to that of a woman decades older.
You know, when we hear terms like vaginal dryness or painful sex, it's very easy for people to categorize this as primarily an intimacy issue.
Right, yeah.
It just gets siloed into sexual health. But if those estrogen receptors are also heavily concentrated in the urinary tract, like you mentioned with the urethra and bladder, this has to be about more than just sex, right?
Oh, it's a massive misconception to just view it through the lens of intimacy. When the tissues of the urethra and the bladder trigone thin out from lack of estrogen, it affects urinary function profoundly.
How so?
Well, in postmenopausal GSM, this thinning leads to frequent urination, urinary urgency, and dysuria.
Painful urination.
Right. They experience dysuria because the thin urethral lining is literally raw and inflamed. It makes every trip to the bathroom agonizing.
Oh, man.
And it also creates a severe susceptibility to recurrent urinary tract infections.
And the FHA patients are dealing with this too. Like a young woman might find herself constantly running to the bathroom or dealing with chronic bladder pain, completely unaware that her intense gym routine and her strict diet are the actual culprits.
Exactly. The tissue is literally changing structurally because it's starving for estrogen.
Okay, if the tissue is literally starving and thinning out structurally, that has to completely change the local environment, right? What happens to the bacteria that normally live there and rely on a healthy tissue structure?
Oh, this is one of the most elegant yet delicate biological pathways in the human body. It's called the estrogen-glycogen pathway.
Estrogen-glycogen pathway.
Yeah, so in a healthy estrogen-rich environment, estrogen stimulates the cells of the vaginal epithelium to thicken and to produce a complex sugar called glycogen.
Like producing flour for a sourdough starter?
That's a great way to look at it, actually, because as those epithelial cells naturally shed and die, they release that glycogen.
Right.
And that glycogen is the preferred food source for Dodoline's bacilli, which we more commonly know as lactobacilli.
The beneficial bacteria.
Exactly, the good guys. And as these lactobacilli feast on the glycogen, they produce lactic acid as a byproduct.
Okay.
And that lactic acid is what keeps the vaginal pH highly acidic, usually between 3.5 and 5.0.
So that acidity is the defense mechanism. It's like a hostile fortress that actively prevents the overgrowth of harmful pathogens or yeast.
You nailed it.
But when estrogen drops, whether you are 72 or 22, the tissue stops making that glycogen. The food source just vanishes.
The food source vanishes, yeah.
Yep.
The lactobacilli starve, and the lactic acid production just stops.
Wow.
And without lactic acid, the vaginal pH becomes much more alkaline, usually rising to between 5.5 and 6.8.
That alkaline shift just destroys the fortress.
It does.
It's like neglecting a garden. The good plants die off, the soil chemistry changes, and suddenly weeds just take over everywhere.
That is exactly it. The environment suddenly becomes highly hospitable to all the wrong things. This leads to conditions like aerobic vaginitis.
Aerobic vaginitis.
Yeah, so in a healthy, acidic vagina, oxygen-loving aerobic bacteria can't survive. But when the pH rises, those aerobic pathogens like E. coli or Staphylococcus, they can suddenly thrive. And that causes massive inflammation and discharge.
That is terrifying when you think about the practical application. Like, wait, so you're telling me that a young, seemingly hyper-healthy 22-year-old athlete might develop recurrent vaginal infections or UTIs simply because she isn't eating enough calories to sustain estrogen production?
That is exactly what I'm telling you, yeah.
And she goes to the doctor, gets a course of antibiotics, which clears the infection, but also completely wrecks whatever is left of her microbiome.
Exactly.
And then the infection comes back because the pH is still alkaline. She gets more antibiotics, and she's just trapped in this vicious cycle.
It's a direct physiological chain reaction. And it's entirely missed if the clinician isn't looking at the whole picture.
Because they're just treating the downstream infection.
Right, without anyone addressing the root cause, which is the low estrogen state driven by her lifestyle.
So if the symptoms are a mirror image, and the microbiome chemistry is a mirror image, how do the paths diverge when we look at solutions? Because both of these groups are facing massive long-term systemic health threats due to this estrogen drought, right? It's not just urogenital discomfort.
Right, no, estrogen is crucial for systemic health. I mean, the two major shared risks highlighted across all the clinical guidelines are osteoporosis and cardiovascular disease.
Both of them.
Yes. Let's look at bone remodeling, for instance. Your bones are constantly being broken down by cells called osteoclasts and rebuilt by osteoblasts.
Okay.
Estrogen's job is to basically restrain the osteoclasts.
The bone eaters.
Exactly, the bone eaters.
Without estrogen keeping them in check, the osteoclasts just run wild and break down bone faster than it can be rebuilt.
Precisely. Bones weaken rapidly. A 20-something athlete with FHA can develop stress fractures or even end up with the bone density of a much older woman.
That is so dangerous for an athlete.
And cardiovascularly, estrogen promotes the production of nitric oxide, which keeps blood vessels relaxed and elastic.
Right.
A lack of it leads to endothelial dysfunction.
Which means?
The inner lining of the blood vessels loses its ability to expand and contract properly, which is essentially the first domino in heart disease.
Wow. So the stakes are incredibly high for both the 72-year-old and the 22-year-old.
Extremely high.
But if the core problem in both groups is simply low estrogen, why not just give the young athlete a birth control pill or like some topical estrogen cream, just like we do for menopause, and just call it a day?
Well, it really comes down to the nature of the condition. For the postmenopausal woman with GSM, her condition is chronic and progressive.
Her ovarian machinery is permanently retired.
Exactly. So she requires ongoing, localized treatment. The guidelines suggest water-based lubricants, topical vaginal estrogen, or specific medications like prasterone, which is DHEA, and ospamifene. We are treating a permanent deficit with a permanent replacement.
Right. But FHA is functional. The machinery still works. The software is just stuck.
It is entirely reversible. If you give that young athlete a combined birth control pill, you are just masking the symptom.
Because the pill might trigger a withdrawal bleed, so she thinks she has her period back, and she might even get a little synthetic estrogen to temporarily help her bones. But her hypothalamus is still completely shut down.
Exactly.
The underlying crisis, the brain thinking the body is starving, hasn't been resolved at all.
The only true cure for FHA is behavioral. It requires increasing caloric intake, resting, restoring a healthy body weight, and dramatically reducing stress.
You literally have to convince the brain that it is safe to allocate resources back to reproduction.
Yes.
And this brings up a detail in the sources that absolutely blew my mind. We always think of medical treatment as pills or creams, but the research shows that cognitive behavioral therapy, CBT, has been proven to help recover ovarian activity in women with FHA. Wait, really? Talk therapy can literally restart an ovary.
It can, yeah, and it comes down to neurology. We've mentioned earlier that cortisol acts as a stop sign to the hypothalamus.
Right, the stress hormone.
Well, in many women with FHA, the condition is driven heavily by psychological stress, perfectionism, or the severe anxiety surrounding food restriction and exercise compulsion.
So they're walking around in a constant state of fight or flight.
Exactly. Their hypothalamic pituitary adrenal axis, the stress system, is in overdrive, pumping out cortisol. So by utilizing cognitive behavioral therapy, you help the patient reframe those anxieties and develop coping mechanisms. As their perceived stress goes down, their cortisol levels drop.
You remove the biochemical brake on the hypothalamus.
The brain finally senses safety. The GnRH pulses resume, LH and FSH flow back to the ovaries, and the estrogen drought ends.
That is incredible.
It is a stunning, empirically proven example of the mind-body connection. Therapy as a direct biological intervention.
It really highlights how sensitive our entire endocrine system is to our environment and our mental state. It's not just some mechanical input-output system.
Definitely not.
Which underscores why a proper medical workup is so vital here. FHA is what the sources call a diagnosis of exclusion.
Right, you can't just look at a missing period and assume it's FHA. Clinicians have to rule out pregnancy, thyroid disorders, pituitary tumors, and conditions like polycystic ovary syndrome first.
Got it.
Only once all anatomical and organic diseases are cleared, and the hormonal labs show that classic low FSH, low LH, and low estrogen profile tied to a stressor, can they confirm FHA.
Wow. We've covered a lot of ground today, looking at an incredible biological parallel.
We really have.
The big realization here is that FHA, whether it's driven by a relentless training schedule, undereating, or intense emotional stress, creates a severe low estrogen state in young women that perfectly mirrors postmenopausal genitourinary syndrome of menopause.
It is a complete physiological reflection, yeah.
Yeah.
The cellular atrophy in the vagina and urethra, the agonizing dryness, the pH changes from the loss of those lactic acid-producing bacteria.
Recurrent UPIs.
Exactly. The recurrent urinary tract infections and the silent, dangerous loss of bone density. It all stems from that same missing molecule.
Estrogen isn't just about getting pregnant. It is a fundamental load-bearing pillar for tissue health, vascular elasticity, and your microbiome. And treating it requires knowing exactly why the estrogen is gone in the first place.
Right.
Because for menopause, it's about managing a new, permanent stage of life with localized therapies. But for FHA, it's a massive alarm bell. It's your brain begging you to rest, to eat, and to find safety.
And recognizing these signs early and understanding the mechanisms behind them can literally save a young woman from decades of irreversible bone loss, chronic infections, and early cardiovascular risk.
It changes how you look at the concept of health entirely,
Yeah.
We started today by contrasting that 22-year-old peak athlete with the 72-year-old retiree.
Yeah.
And we've seen how chronic stress and caloric deficits can effectively trick a 20-year-old's reproductive and vascular systems into looking and acting like a 70-year-old's.
It's sobering.
Which leaves you with a final thought to mull over.
Yeah.
In our modern culture of extreme diets, fitness trackers, and relentless hustle, how many other quote-unquote age-related conditions are we prematurely triggering simply by refusing to give our bodies the energy and the rest they're practically begging for?